Prostate cancer develops in the prostate, a small walnut-shaped gland located below the bladder and in front of the rectum in men and people assigned male at birth. This tiny gland secretes fluid that mixes with semen, keeping sperm healthy for conception and pregnancy. Prostate cancer is a serious disease. Fortunately, most people with prostate cancer get diagnosed before it spreads beyond their prostate gland. Treatment at this stage often eliminates cancer. How common is prostate cancer? Prostate cancer is common second only to skin cancer as the most common cancer affecting men and people. According to the US Centers for Disease Control and Prevention, for every 100 people with prostates, 13 will develop prostate cancer at some point in their lives. Symptoms and causes. What are the symptoms of prostate cancer? Early stage prostate cancer rarely causes symptoms. These issues may occur in the disease progresses. Frequent, sometimes urgent need to pee, especially at night. Weak urine flow or flow that starts and stops. Pain or burning when you pee, dysuria. Loss of bladder control, urinary incontinence. Loss of bowel control, fecal incontinence. Painful ejaculation and erectile dysfunction. Blood in semen, hematospermia or pee. Pain in your back, hip or chest. Are prostate problems always a sign of prostate cancer? Not all growths in your prostate are cancer. Other conditions that cause symptoms similar to prostate cancer include benign prostatic hyperplasia (BPH). This condition enlarges your prostate gland but doesn't increase your cancer risk. Prostatitis. Prostatitis is a benign condition that causes inflammation and swelling in your prostate gland. Bacterial infections are often the cause. What causes prostate cancer? Experts aren't sure what causes cells in your prostate to become cancer cells. While normal cells eventually die, cancer cells don't. Instead, they multiply and grow into a lump called a tumor. As the cells continue to multiply, parts of the tumor can break off and spread to the other parts of your body, metastasize. What are the risk factors for prostate cancer? The most common risk factors include age. Your risk increases as you get older. You're more likely to get diagnosed if you're over 50. About 60% of prostate cancer occur in people older than 65. Race and ethnicity. You're a greater risk if you are black or of African ancestry. Family history of prostate cancer. You're 2 to 3 times more likely to get prostate cancer if a close family member has it. Genetics. You're at great risk if you inherited mutated change genes associated with increased breast cancer. Other potential risk factors: smoking, prostatitis, having BMI greater than 30, having obesity, sexually transmitted disease, infections, exposure to Agent Orange, a chemical used during Vietnam War, diagnosis and test, screening test for prostate cancer, digital rectal exam. Your provider inserts a gloved, lubricated finger into your rectum and feels your prostate gland. Prostate-specific antigen blood test. High PSA levels may indicate cancer. Levels also rise if you have benign conditions such as BPH or prostatitis. Diagnostic procedure for prostate cancer. Imaging, an MRI or an ultrasound can show images of your prostate gland. Biopsy. During a needle biopsy, removes a tissue sample for testing in a lab for cancer. What are the grades and stages of prostate cancer? Gleason score and cancer staging. The more abnormal cells you have, the higher your Gleason score. Staging prostate cancer. Cancer staging allows your provider to determine how advanced your cancer is or how much it's spread. Cancer may be in your prostate gland only, local, invading nearby structures, regional, or spread to other organs, metastasized. Surgery. A radical prostatectomy removes diseased prostate gland. Radiation therapy. You may receive radiation therapy as a standalone treatment for prostate cancer or in combination with other treatments. Radiations can also provide symptoms relief. Systemic therapies. Hormone therapy. The hormone testosterone boosts cancer cell growth. This medication works by preventing testosterone from reaching cancer cells or by reducing your testosterone levels. Chemotherapy. Chemotherapy uses medicines to destroy cancer cells. Immunotherapy. Immunotherapy strengthens your immune system so it's better able to identify and fight cancer cells. Targeted therapy. Targeted therapy zeroes in on the genetic changes, mutations that turn healthy cells into cancer cells to prevent them from growing and multiplying. Focal therapy. Focal therapy is a newer form of treatment that destroys tumors inside your prostate. Refer to my previous video on prostate enlargement, BPH.
Subscribe and check out these cool videos.